Welcome to Dental Vibes. I'm Gabby.
And I'm Carla.
And we are dental assistants that love to talk about dentistry. In our channel, you can expect to see content for our fellow dental assistants and also for anybody that loves their teeth and wants to take care of it. So make sure you go ahead and subscribe to our channel now.
And if you're returning back to our channel, thank you so much for your support. Don't forget to hit the like button. And today we're going to talk about everything you need to know before becoming a dental assistant.
So grab a seat.
Yep.
We get messages on a daily from people that are considering becoming a dental assistant. Of course, they have so many questions. They don't know what our day is like. They don't know what dental assistants do. So we thought it would be a good idea to get the questions that were most asked and do a video about it.
Yeah.
So what we have for our first question.
Let's see. What do dental assistants do? I don't know. There's too many things.
The list is gonna be
like too many. I mean, you have the word assistant, so anybody that holds a job as an assistant in anything, you're just like a BCB, basically.
Yeah. Let's try to list it.
Okay.
So X-rays,
taking impressions,
pouring models,
patient education,
assistant to doctor, of course,
ordering supplies,
sterilizing instruments, rooms, setting up. Sometimes some assistants will have the hygienist scale the teeth first, and then they go in and they polish the teeth. Sealants, right? We're going to be doing sealants. Temporary crowns. I mean, some offices have the assistants do most of their lab work, so like retainers,
wax plates,
you name
anything.
If you're going to be working in ortho, you're going to be placing
the brackets, changing the wires. So there's just like
the list goes on and on.
Yeah. If you're expecting to just sit there and look cute, which is kind of like what I thought dental assistant,
or just like we just have to hand the instrument to the doctor and that's it.
That's what I thought we did.
That's
like
not what happened. Yeah,
that's not what happened.
You're like, oh, that sounds like a good career. I want to do that.
We highly actually encourage you, if you know, after watching our videos and you're still like, I don't know, you can go ahead and maybe shadow at a dental office and follow a dental assistant.
That is the best thing to do because, like you said, when I decided to become a dental assistant, actually, when I went in to check out the programs in the school, I was looking into medical billing.
Oh, okay.
Coding and billing. So I did not even think about dental until I got there, and I don't even know how that came up. And I was like, you know what, dental assistant, that sounds like a good idea. And honestly, like, I knew I liked teeth, but I had no idea what we had to do until I got into the program. I'm like, what did I get myself into? Thankfully, it worked out, and I love it, but it's a lot, and it's not for everybody. No. So shadowing is a great idea.
Yeah. The next question is dental hygiene or dental assisting? That's a big question because it really depends on what's your career path. I mean, what are you trying to accomplish? Because they're two different things. And I think the main question is, or I think a lot of people expect that, oh, I'm going to be a dental assistant because that's less schooling and I can start working right away. Yeah. Oh, but then it's like, I'm going to become a dental hygienist next while I'm still working. Well, you can't really do that. So it just depends what you want to do. Also, different duties, right?
Different duties, and make sure you check our video to see exactly the difference between a dental assistant and a dental hygienist. We're going to go ahead and link it here. But yeah, the main thing is a lot of assistants will start as a dental assistant and they will go into hygiene, which there's no issue there. But you have to be mindful that once you get into the hygiene program, you cannot work. It's a full-time thing. So if hygiene is your end goal, just maybe go for that. Because doing dental assisting, you're going to pay for a dental assisting program if you know that's the route you're going. You're going to have to learn all the dental assistant duties. You know, do all that, and then
it's kind of like sidetracking a little bit too. I mean, it'll be a good foundation, but you know, if you just want to be a dental hygienist, just do it. And again, the shadowing. Very important. You can call a dental office and see if you can shadow, or if you already know your hygienist and
Yeah, you can shadow your hygienist and see if that's what you want to do. Because for me personally, I don't like to waste time and money. And it's like, if I know I want to be a hygienist, and I know that I'm going to have an associate, I'm going to have to do the prereqs, the science courses, and then I'm going to have to go to school full-time for 2 years, and I'm not young, you know, like I'm not going to want to go and do assisting and then do hygiene, you know, it's just, but again, whatever you decide, maybe you're super young and you want to do assisting for now and then decide if you want to be a hygienist, that's fine. But as long as you do your homework, you know your information, so you can make a better decision.
Next question. How much do dental assistants get paid?
That's a hot topic in dental assisting.
And the truth is, it's just a wide range, because dental assistant, it depends. Are you certified, just registered? Do you have your expanded functions, which is certification with that?
What state are you from?
Who are you working for?
Where are you working from? Exactly. Like, you talk to some dental assistants that, you know, have been getting low pay for a long time, and they're very bitter. They're like, you know, dental assistant was the worst decision and this and that. But you know, you can't go by what they say, because every state have their different pay range. Every doctor, some doctors are gonna be so cheap, and you could be the best assistant in the world. They're not gonna pay you what you deserve. Some doctors, they are just doing so well that they will pay you this amazing salary without experience. So you just don't know how much you're gonna get paid until you do your research. You know, what's the pay range in your state? Also, skills talks so much.
I love what you always say, experience, right, over, what's the other thing?
Skills. Experience does not mean skills.
No.
And once if you decide to go into dental assisting and you get into the field, you're gonna see that unfortunately there are some assistants that have been in the field for a long time. And the skills are not there. So it's not like, hey, I'm gonna walk into this office and I'm gonna tell them I have 15 years of experience and I deserve $30 an hour.
Because you may not get the same pay. You'll probably be lower than the dental assistant that's been working there. Probably she's been out of school for the last 5 years only, but she's better. She can hustle a lot. And I'm not just saying like, oh, super cleaning and putting up with BS. No, I'm saying, how good are her temps? Is she
her
patient education, what's the report from the patients? All of that you have to take into consideration. So again, when we talk about the bitter dental assistants out there, they're like, oh, I've been in the field for this long.
It's a dead-end job.
Well, you're doing something wrong, because it's a very rewarding career if you make it that way.
And I think that also it depends on your personal situation, right? If you are a single person, you don't really love expensive things, and you're just okay with, you know, just having a reliable job. You like the hours, you like the office you work for, you can pay your bills and have an okay life. A lot of dental assistants are just happy with that, and they are probably gonna, you know, retire as a dental assistant. Now, some other people, they have these big dreams and these ambitions, which it's
like
great.
Being rich, you
Yeah,
know, like
that's not gonna
you're not gonna accomplish that.
Yeah. So you just have to be honest with yourself and say, hey, these are my expectations as a dental assistant. That's not gonna cut it for me. So, you know, it all depends.
Or maybe you just want to like start in it, and you're like, I'm not sure how far, like, do I want to go to dental school or dental hygiene school or in sales, whatever. You can start just as a dental assistant. You'll get valuable knowledge for sure. All right, the next question is, which dental assistant program is better? And they're referring to either the accelerated ones, that is just about 3 months, something like that, or the traditional in-class, which can last up to a year.
With your externship.
So let's see. I mean, obviously we're a little bit biased. We both went to the traditional dental assistant programs. So
like 10 years ago.
So it just really depends. I mean, I would recommend, when somebody asks me directly, I recommend the traditional because you get so much out of it, so much core knowledge that you will need. It's not gonna go to waste. As opposed to if you're just learning online and have to get everything, learn everything on your own, or very quickly if you just go once a week, you know, for like 3 months. To me, that's like
that's
nothing.
not enough. I mean, maybe you're gonna work super hard and you're gonna do your research at home, study at home with YouTube videos.
Our YouTube videos.
Yeah, our YouTube videos, yeah. And everything that's gonna be an addition to that once a week, but I don't see that being like getting you prepared to go into the dental world.
Yeah, and then, oh, by the way, there's also the ones that maybe train on the job.
Yeah.
And we created a video, right, talking about either going to a program or being trained on the job. There are many dental assistants that have been trained on the job, and shout out to them. However, then you would have to find an office that is willing to do that, because they would have to invest a lot in you by training you, and not many do that.
Right. I mean, just think of somebody just learning how to read and write.
Yeah.
That's how it's gonna be. And a lot of offices, they're fast-paced. They don't have the time to train somebody from zero like that. Now, if you find an office and you know they're gonna be patient enough to do that for you, then cool. But
you still have to probably go back and get your certification.
Yeah, it's just tough.
Yeah.
I think the difference between the long program and the accelerated program is, you know, of course, the longer program, you're going to have more hands-on training. You're going to have more knowledge.
Yes.
And a lot of times, they will find your externship site. They will find you, or at least help you find a job.
Yeah.
And a lot of the accelerate programs out there, they're just kind of like, okay, you're done.
Yeah.
Good luck.
Yeah.
So it's just whatever route works for you, but do your research.
Yes.
And just know that if you don't do, and even with the long program, I did not feel confident and ready whenever I graduated. So just know, regardless of what you pick, it's gonna be a lot to learn.
Yes.
You need to be ready, and you're probably gonna cry while you're learning, but that's okay.
Yeah, it's just part of the process.
Part of the process.
All right, let's see. This is a good one. What are the struggles of the dental assistant? It's more like, what do we struggle with?
I mean, it's a tough job.
Yes.
Because as an assistant, you are supposed to be everywhere at the same time, know everything at the same time, and do everything at the same time.
Absolutely.
So it's very hectic, multitasking.
Very dynamic.
Yeah, multitasking.
Fast-paced sometimes.
Is a must.
And you have to be a team player, because you work with other dental assistants, dental hygienists, and the dentist, and you gotta have patience with the doctors.
Yeah.
Or maybe they have patience with us, I don't know. But one of the biggest things that we've learned since we started Dental Vibes is all the issues that dental assistants have with the dentist. It seems to be like an epidemic sort of thing.
Yeah.
But it happens, and I've met one or two.
That dentists are just mean. And you know, you have to understand that doctors will have a high expectations. High expectation because we are dealing with patients, and it's a lot of responsibility, right? So some doctors, they will not be so patient. They will not be so understanding when you have mistakes going on. So it really depends on how you handle it and if you picked the right office for you, right? We always talk about this. If you are having issues at work, make sure you stand up for yourself. You don't let anybody walk, all over you. And if you realize, hey, I'm not happy, this office is toxic, that there are many offices out there that you will find the right fit for you. You just have to look for it and not be naive whenever you go for the interview and work an interview. Make sure you ask those questions to really figure it out. Is this really the right office for me?
Right.
And then you can make the decision to work there.
Yeah. Now that we got the bad out, what are the benefits? And not just like what are the benefits of being a dental assistant, but like work benefits. Now, there is, you know, private offices and corporate dentistry. Private offices, if they're very small, they may not be able to offer you this great incentive packages, right? Or sign-in bonuses and whatnot. However, there are plenty of dental practices, whether they're bigger, medium-sized, or small, that do offer benefits. And what are some of those? We'll talk about 401k,
vacation
paid
time,
vacation, paid holidays,
medical insurance, and all that. I mean, we hear a lot of dental assistants complaints.
Yeah.
And, you know, a lot of them will say, oh my God, I've been in the dental field for so many years and, you know, benefits were never there. I'm considering changing fields because of this, or I'm ready to retire and I have no retirement package and things like that. But it's like, again, there will be an office out there that literally, I hear it sometimes that they offer some killer bonus. There's, you know, 401k, vacation, everything that you could possibly want in a benefit package they offer. So it's really about you looking for that right office for you.
Yeah, I mean, and you may not find it at the beginning, but you may have to move on to another offices that does offer you. It just depends what's most important for you.
Also, the hours. I feel like I don't like to work weekends or nights. No. I like my, you know.
I don't like retail hours. Yeah. You have to work holidays.
Yeah. I mean, some offices like 7 to 3, some offices 8 to 5. You're gonna see all different hours, but some offices, they don't work Fridays. Some offices will work a Saturday, like once a month. But for the most part, you're gonna have your weekends free.
And office hours.
So it's just, you just gotta see that the benefits aren't there, the hours aren't there. You just have to find the right office.
Okay guys, we hope that all this information was helpful to you. If you have more questions, please don't hesitate to leave us a comment.
And we actually feel thankful that you trust us enough to message us with all these questions, and we hope that we can give you all the information you need to make the best decision for you. And if you decide to stick it out and become a dental assistant, you make sure you subscribe to our channel.
Also hit the notification button so you don't miss any of our new videos, and of course like this video, and we'll see you next time.
Keep smiling.